So when you arrive on the unit, you will be greeted by one of our nurses and nursing assistant. We'll get you settled in the room, and she will explain what will happen during the course of your stay here at St. Peter's. When you arrive, a nurse will show you how to use the call light, and that's important because we do not want you to get out of bed while you're here by yourself. Even though you might feel wonderful, no pain, we really want you to call us and we'll help you to the bathroom, we'll help you out of bed to the chair or getting from the chair to the bed. So it's important that you don't fall, you don't hurt yourself. We don't want you to hurt the leg that you just had surgery on. So please make sure you use that call light. Even if you're nauseous, we want to make sure that we do have medication for you, and we will be happy to give it to you if you let us know if you're nauseous. Also, if you have pain, it's important. We want to manage your pain. You're going to have pain post-operatively, but we want to make sure that you're comfortable. We're going to ask your pain score. 0 is that you have no pain, and 10 means that you're having uncontrollable pain. You can't even talk while you're in that much pain. So you want to make sure you call the nurse, and we will medicate you according to your pain scale. Another thing, we do use a multimodal approach. We will be giving you medications throughout your stay here, pain medication, but sometimes you just need a little bit more pain medication. So that's when you need to call the nurse so we can give you that pain medication. Remember, it's not going to be totally pain-free, especially during therapy. You're going to have some discomfort. And with physical therapy, once you're done with physical therapy, we'll get you back into bed or sitting you in the jerry chair. We'll elevate your leg and we'll put some ice on it, and that will help with the swelling and the pain.